All right, we've been leading up to it. You've been waiting for it. Let's talk about RSV vaccination and its benefits and challenges in older adults.
Okay, well, in speaking about efficacy against both lower respiratory tract disease and then severe lower respiratory tract disease, the vaccines we have are actually very good. There's a little variation in what their effectiveness is, but the GSK product ranges from 83% effective against lower respiratory tract disease all the way up to 94% effective against severe lower respiratory tract disease, whereas the Pfizer product, 67% effective against lower respiratory tract disease and 86% against severe lower respiratory tract disease. Now, according to the ACIP and the CDC, these were not significant enough to recommend one product over the other. So you don't have to dive into all the details to decide what to purchase for your office if you're looking at including RSV vaccinations in your office. Just some other data points: a number needed to vaccinate to prevent one outpatient visit, with coming to your clinic, going to an urgent care, going to the emergency room and being discharged. That's about 90, all the way up to 100. So about 100 people have to be vaccinated to prevent an outpatient visit. And to prevent a hospitalization from RSV, that ranges from 1,300 to 1,500 vaccines have to be given. When you were talking about preventing death from RSV, that ranges from 27,000 up to 31,000 doses of vaccine have to be given out to prevent a death.
That's really good points. And I think that the increased efficacy with more severe disease is something I always try to impart to patients when it comes to vaccination. The vaccine will be less effective at preventing you from getting sick in the first place with RSV, but what it's really effective at is preventing those more severe cases where particularly if you're in the ICU and or intubated. And so I think that's where the real value is. And the more frail you are, the more risk factors you have. The more that vaccine is really going to work to help protect you from those really negative outcomes.
I think it's really easy to explain that to patients because now with COVID, most of us are vaccinated, yet we keep getting COVID. But then we think about, but I'm not in the hospital. I didn't die.
Right.
And so that's the reasoning here. So getting vaccinated, even other vaccines, it doesn't necessarily 100% prevent the disease. Like patients are needing education on that, but it will prevent them from going into the hospital and dying.
Sarah, would you mind kind of describing, how this would affect the epidemiology in terms of its morbidity and even mortality by the broader application of this vaccine among older adults?
Absolutely. With these efficacy rates, which are fantastic, and I think Pam, you brought up a great point of one of the miscommunications with the COVID vaccine. I think at the first we thought, and it did prevent infection. But now we're kind of going, but that's not the point. The point is to prevent hospitalization, to prevent severe illness. And what's great is with these efficacy rates, that's exactly what we're going to do. There are some situations where if we could get about 60 to 65% coverage, again, this is the 60 and older population, obviously focusing on those at high risk. I mean, we could prevent that 8 to 15,000 deaths per year range. We could be preventing anywhere from 50 to 80,000 RSV hospitalizations during a season. We could be saving up to $1 billion in associated healthcare costs in 1 year. And so these are just really significant things that we can put a dent in by just increasing our vaccination rates. And even, we're going to prevent up to 2 million symptomatic RSV cases per year if we can shoot for this 60%, 65% vaccination rate because of how efficacious these vaccines are already proven to be.
Yeah, and we're not there yet, certainly, with one season of experience in terms of the vaccination rate. But I have a feeling things will pick up, in 2024, 2025. Last year it was a lot. I felt like a full-time vaccine counselor. In going from especially September through November, and it was really hard to get in other health maintenance efforts actually during that time. So this year I think we'll be more ready, and hopefully the public I think is more informed and certainly hopefully ready to accept the RSV vaccine along with our other fall-time vaccines, principally influenza. In terms of the recommendations from ACIP as to who should be vaccinated and how they should be vaccinated, the RSV vaccine, either one, as you mentioned, is acceptable. Absolutely right. It's for folks 60 years of age and over. The vaccine should be delivered in the late summer or early fall, so you always want to give these vaccines earlier than the RSV, the traditional RSV season, which seems to be shaping more into form, with a greater spike in the winter, whereas it was really disrupted in 2020 through 2022, and the big question is, so if my patient had a RSV vaccine, when do I revaccinate them? Is there a booster that's required? And right now, I'm not aware that there's really any guideline on that. Do you have any other perspective or knowledge on that issue?
They have studies going out 2 RSV seasons showing that the efficacy is stable. Of course, the studies are ongoing, so by next year, we'll have another season of data. But right now, there is no recommendation for a booster shot. That may change, but that's the reason I'm telling patients right now in spring, early summer, not to get the RSV vaccine, but to wait because the season's over. And so we don't know how long these antibodies are going to last in these folks and whether they're going to need a booster. And if there are always exceptions in medicine. You never say always. But if somebody is severely immunocompromised, has severe lung disease, they have little kids around, I will have a conversation with them about considering the RSV vaccine right now. But for the majority of older patients, I am waiting for RSV season to start now.
Yeah, I think another interesting issue is what if they live in Central Florida, where there really isn't a strong peak in the wintertime associated with RSV? So yeah, that might be another situation if you live in a more tropical climate where RSV doesn't have that significant winter spike. It might be reasonable to give it any time, and I think you actually feel pretty comfortable with that, just given the fact that we do have data through 2 RSV seasons that the antibody levels are maintained, so protection can be assumed to be maintained over that time. But yeah, it's a balance. I think it's something that it's an iterative process. We'll learn more as more studies that are done. One thing that I'm very sure about is that you can co-administer other vaccines along with the RSV vaccine. As I said, especially for folks in my practice, many times they're missing multiple vaccines at once. And when I get that moment of where the light shines upon us and we can actually have some time to talk about health maintenance and prevention, we are just going to go, we can load up on vaccines. And like I said, then the patient's protected. We can cross that one off the list. And that's always, I feel very good when my prevention list is checked off. Patients don't really care about it, but I feel great. And so, but because I know they're protected, because it's worth it. It's worth the extra time and the conversations, because it really does yield good outcomes. And as you described, the vaccines have some very good data behind them. But despite the good data, that doesn't mean they'll always be applied. We've certainly seen, I think, more challenges, novel challenges in terms of vaccinating adults in the last several years. And so we are going to have another program, which I would encourage you to tune into, that looks a little bit more at the data on efficacy and safety of the RSV vaccine. And very importantly, how do we actually apply these in the best practice in our practice to really get the most vaccines on board and protect those who really need it. It's been a pleasure. Thank you so much, Pam and Sarah, for joining me in this particular episode. And I really appreciate your insights. They're smart, they're pragmatic, and hopefully for our audience, you enjoyed this program. Take care.
Thank you.